Well, the pandemic has forced a lot of people into a mental health crisis. In his recent proclamation, the governor outlined why young people are especially impacted right now. A few alarming statistics, for example, Mary Bridge Children's has 67% of its young people admitted for mental health reasons now. If you move over to Swedish, 24.5% of young people are admitted for behavioral reasons or suicidal thoughts. That's compared to 10.8% of everyone admitted before the pandemic. And at Seattle Children's, 1 or 2 children are admitted for suicide attempts every single night. The psychiatric unit is over capacity. That's where we find King 5's Callie Greenberg live this morning. Callie, the clinical director for the psychiatric unit there at Children's, says there are things parents in the state can do to help kids, right?
Right. Those numbers are just really hard to hear. And Dr. Thompson called this a crisis when we spoke, but it's important to note that these medical emergencies among kids when it comes to mental health, this has been a growing trend for some time. And the doctor says that Washington State has fallen behind. Dr. Alicia Thompson, she said that even before the pandemic, the hospital's psychiatric and behavioral health units, 41 beds, were always filled. But here's the thing. Now, during the pandemic, the emergency overflow space is also full, and in some cases, kids are needing to be put on a wait list to get professional help. She didn't shy away from the fact that kids are hurting and said numbers show a 30% increase in youth suicide just in King County during the pandemic.
All of those buffers of social supports and fun things to do are really gone. And you add to an overburdened mental health system and difficulty with getting kids in to see somebody to get some help. That's just kind of compounded this crisis, in my opinion.
Again, this is not an easy topic, especially when adults are dealing with their own symptoms of isolation, but there are things people can do right now. Dr. Thompson said you can write your representative asking for more funding for mental health at the state level. She said Washington right now ranks 36th in the country for youth suicide, and her program is mostly funded through donations. You can check in on your kids. This is not easy. It might mean having a tough conversation and asking questions like, have you thought about hurting yourself? And depending on what comes out of that conversation, try and get help as early as you can, and then prevent access to harmful items. This means medication, firearms, make sure those things are locked up. Now, through my whole conversation with Dr. Thompson, she said she is hopeful, but she did not shy away from the fact that the pandemic is going to have long-lasting effects on kids really across the country. Live in Seattle, Callie Greenberg, King 5 News.
Hope everyone can find the help they deserve. Callie, thank you.